if you have any problems accessing the site now, it's you can still watch. Do you know what I mean? It's sometimes it only works on HSE devices. The link that I'm going to show you. So I know a couple of you are joining from home, and they mightn't have their work piece there. So just to let you know that we will be sharing a link after. Okay. Okay, so I'm just going to. Okay, so can you see that slide? Someone will just give me a thumbs up. Yeah. Okay, just give me 2 seconds. Okay. Okay, so my name is Carol McCann, and I work in the newly formed ICT Digital Health Office, and my colleague Olivia works with me as well. We are a brand new office that's supporting the CHO, and we are not part of the ICT infrastructure. We're part of the community structure, so part of the CHO and the management team. And our job is really to promote digital ways of working and digital capabilities and training. And that's why we're doing this little session, because Mags and the team, Mags Kelleher, thought would be useful for you at the stage that you're at. So we will be in touch at a later date, kind of outlining the role of our office and what we can support you with. But as I said, we're just starting out, and we're doing this little piece early on with you. So today isn't in-depth training; it is more a demonstration, as I've mentioned, just to give you a feel for what Health Atlas is. So, what is Health Atlas Ireland? So it's been developed over the last 10 years. And again, in the document I circulated, it gives the whole background on it. And it's fantastic. So it's a website, but it's pulling in information from all aspects of the HSE, from the census, and from all other lots of other key government agencies. And that little map that you see there kind of shows you what it does. It can show you the kind of road mapping structure. It can show you where there's hospitals, where there's primary care centres. It's really one of the things that has been done very well. So it's good to use it. So you need to access it from a web browser and from a HSE machine, the elements we're going to look at today. And using the Chrome browser is usually the best option. Okay. So the Chrome web browser is the recommended one, as I've said. It needs to be a HSE device. And today we are going to focus on the Atlas Finder element of Health Atlas Ireland. Okay, so if you can see the screen here in front of me, up at the very top, you have the HSE logo and you have Finder. And it says available to all Atlas users. And you can see the little green map of Ireland with the H in it. And what this section allows you to do is to find addresses, services, or air codes, but also map sites, boundaries, populations, and profile demography by areas. Okay, so what I'm showing you today is only one aspect of it. If you want to query more hospital KPIs or community healthcare data, so all those KPIs that you have struggled with and had to deliver over the last few years, that's all programmed into this system and can be used. I have never gone into that aspect of it, but you can apply to get full Health Atlas Ireland access. And if you want to access the community healthcare component, you have to send an email to businessintelligent@hse.ie. So that little area here I've circled, and they will ask you what you wanted for, and they'll kind of grant you a level of access. Now, once I knew I was doing this training, I did apply for that access, and I still haven't heard back from them. So I'm not sure if that's the experience of other people. We might talk about it at the end. And I'm just hoping that email is still manned, because if people do want fuller access, it seems to be an issue at the moment. But regardless, for what I'm going to show you today, you don't need that. So there's the hospital quality assurance system, there's emergency data analyzer, and all sorts of geo directories and estates directories. And it's really it kind of blew my mind. I didn't realize all that it could do. So the Atlas Finder element is what we're going to focus on today. So these are all the data sources it uses. And you know, the CSO, Road Safety Ordnance Survey, SDU, contracts, corporate, HR, health links. There's a huge amount of information, so you know, that can be tapped into. So today's session, as I said, it's a demonstration rather than in-depth training. We're going to focus on Atlas Finder. We can take questions through the chat function as you think of them, but we will have a quick Q&A at the end as well. Okay, so I'm going to go straight into the actual website. And again, if you can't access that now, don't worry. For whatever reason, if your internet's down or something, you can easily just look and see what's happening. Okay. Okay. Can we all see that? Yeah, great, lovely. Okay. So we log on to Health Atlas Ireland at the top in our browser, and this web page comes up. It can be a little bit slow to generate maps and to pull in information because it's pulling from kind of probably all different sources. So don't depending on your web speed, it might be a little slower than normal, but that's okay. So we click on the Atlas Finder option at the top, little green Ireland symbol, and it brings us into this screen. Okay. So at the very top, we have a kind of a Google Maps type piece where you can put in an air code or search for a service or a name. Okay, and that's very like the Google Map sort of functionality. But underneath it is the bit we're going to focus on today. So there's 4 buttons, one for area, and that's about the geography and about the mapping side of it. The profile is about the data that you can pull in to that particular area that you're mapping. The table option, which is grayed out here at the moment, allows you to pull all the profile information like census or you know, demographic information. That pulls it into a kind of a tabular format for you. And then there's a map option of it. So the first 2 buttons, the area and the profile section, allow you to pick your area and pick what you want to profile. The output of those 2 then gives you either a table with all your profile information, but also a physical map. So I'm going to focus on these 4 buttons just for the moment, okay? And I am going to pick, I'm going to click on area first. Okay, so this is, as I said, very user friendly. It's like an on-off system. You tick something, it comes on, you untick it, it goes off. And there's no formal training on this on their website or anything like this because it's kind of very intuitive. Once you get in and have a look at it, it's kind of just, you can't break it as such. You're just generating and turning on and off symbols. Okay, so along the left here, we have the various kind of health structures. Okay, so you'd be delighted to see they've added the RHAs in. Another boundary or another change we're going to experience in the coming next year probably. They have added in Sláinte Care Healthy Communities. They've had it in CHOs, so I'm going to click on CHO. And so the CHOs in the country pop up. And if you want to pick the one that we live in, you tick it and you press select. Okay, so I'm just going to do that just to show you. So it processes. Now, by default, it's bringing me into a table of all the areas that I'm in. So I'm just going to go back out of that for a second. Okay, so I'm going to pick my, I'm going to go from CHO down to CHN. So when I click on CHN and I click on CHO8, it lists each network for which some of you will be taking up the mantles or have taken up the mantles. So that's really good for you if you want to pick your own CHN and profile it. And again, that's the point of today. Okay. It also go down to primary care team level, which again is what your networks are made up of. So you can see here, these are the 60 odd